Operation Triple Zero. Operation Triple Zero. Operation Triple Zero. Operation Triple Zero. Yeah, send your hero. Operation Triple Zero. Operation Triple Zero.
Imagine a world where every young person can confidently say, I own my health. This is OTZ, a bold movement igniting hope, community and empowerment. With 0 missed appointments, 0 missed doses, and 0 detectable viral loads, OTZ transforms lives, proving that when young people lead, anything is possible.
I started Operation Triple Zero because as a pediatrician, I recognize how the adolescent brain works. I know that they have assets within themselves that they could use to make choices about their treatment. And I rode on those assets to ensure that adolescents can make right choices that result positive health outcomes among adolescents.
So the OTZ program looked at a systematic way of designing these solutions in a club setup driven by the young people themselves at the facility level, those who are living with HIV, to support one another to successfully address the gaps and challenges in HIV prevention and treatment. And we are glad because I think it's a message to programmers and to the health sector that the wearer of the shoe knows where it pinches most, and if you give them a chance, they will design solutions.
And this movement that began from one facility, Kenyatta National Hospital, over the last 10 years has grown to become a nationwide movement. There's excellent coordination. And as a result, if you look at the outcomes of adolescents and young people with HIV in this country, the retention rates have gone up, viral suppression rates have gone up. There's more ownership and acceptance from national to county level to community level.
Within a period of where the movement started going across the country, training of the adolescents within the facility, ensuring that we shift from them feeling as victims of a disease, but as heroes for taking their own medication seriously. What we saw is really a change. And we were looking at the data for last year to look at how far we've come from struggling with viral load suppression of about 50% to now where we can speak the adolescent getting about 73.2%.
OTZ thrives on collaboration, uniting powerful partners like Hope Worldwide Kenya, CDC, PEPFAR, and county health teams. Together, they break down barriers, reaching every corner of Kenya, because when young people thrive, communities flourish.
As we interact with them, we will find some. To date, maybe about 63 within this implementation who are HIV infected. And we did not know what to do with them as much as just refer them to a health facility and all that. And when we came across OTZ, then we found, wow, we can do this. We can now have our own OTZ club within DREAMS program.
Within the HIV program, you'll find that there are different parts of the service delivery where people with HIV participate in actual service delivery. And the OTZ program is one such area. So we have OTZ champions at high volume facilities, and they actually take the lead in being able to talk to other young people about what it entails to have, to receive HIV services, be able to encourage them using their own lived experience. And in terms of what it takes, and it's different for different stages.
Behind every remarkable movement are visionary leaders. Meet Damaris Nyamweyer, the fearless president of OTZ, a beacon of strength, friendship and advocacy. She is simply a passionate champion, dedicated to arming youth with the tools for vibrant, healthy lives. For her, OTZ is more than a program. It's a revolutionary force for change, lighting the path to a brighter future.
So OTZ has directly impacted my life, as I mentioned, in terms of giving me the courage to speak in front of people, in terms of also knowing to manage my own health. As you know, I'm also a patient before I'm a president. So I have also learned on the steps on how to properly manage my own health. We have seen successful stories of young people who were struggling to adhere to treatment and now are adhering. Some of them have even gone to steps of getting married and having kids who are negative.
Since then, the project has really grown, and currently in Nairobi we have 59 facilities implement Operation 000 with more than 1,600 adolescents currently enrolled, with very good viral suppression of 93% as at the end of September 2024. Our sister projects in Machakos, Makueni, Kitui, Kisumu and Migori have equally implemented OTZ more than 150 facilities in the Ciheb Kenya programs. And since then, Operation 000 has expanded from just the 3 zeros of zero missed appointment, zero missed drugs and zero viral load suppression. And currently we are implementing Operation 000 Plus that targets the pregnant and breastfeeding adolescents with an aim that these adolescents are going to give birth to children who are free of HIV.
The process of motherhood with HIV was a bit foreign to me because I didn't know what to do. At the back of my mind, I was scared of passing HIV to my baby. Along the way, OTZ Club was formed within our clinic, and that also enhanced our support group. I was able to meet people who are like-minded. I even formed friends, like lifelong friends from that support group that I always knew I can always fall back on.
Every journey has its guides, and OTZ's success is powered by dedicated health heroes, clinicians, counselors, and facility leaders who walk alongside these young people every step of the way. They cultivate a nurturing environment, helping each participant reach for their 000.
We have an OTZ corner, that is a club, and a youth-friendly center. So they are able to come there specifically. We grouped them. They usually come, and we have specific days for them just to come, and we are able to meet with them, the healthcare workers. They are encouraged as a team.
We have different concerns for the adolescents. We've had some innovations in place. We have peer-to-peer case management for the OTZ. So all the adolescents, they are paired with a case manager who does daily audio support for them as a reminder the exact time they're supposed to be taking their medications, and it has helped us a lot in ensuring viral suppression.
The architects of OTZ are fooled by a powerful vision for the future. They are paving the way for a stronger, more vibrant OTZ that reaches every corner of Kenya, lifting up every young person it touches.
About the 19,000 adolescents and young people who are in care in Nairobi County, we have an adherence of around 94%. Just slightly below the WHO targets of 95, but I guess we are doing very well. We still have a few challenges, but working through and with adolescents, I believe we will overcome the challenges.
And moving on, we have been able to scale up OTZ across different countries by first ensuring that we invited them to come and learn from our programs, and subsequently they will take this to their countries and we will support them to scale it up across different countries.
With OTZ, these young people are not just surviving, they are thriving, redefining the future where HIV is a part of their story, not a barrier. This is Operation 000, where every young person living with HIV has the power to take charge, to flourish, and to dream.
OTZ, to me, is a mentorship therapy.
Positive living.
A lifesaver.
Quality life.
Groundbreaking.
Fun.
Impactful, sustainable, transgenerational.
Innovative, transformative, and simply life-changing.
OTZ is my life.